Morning, morning, morning. Good morning. Good morning to you.
This morning, we're also going to have the National Council on Substance Abuse. They have brought along two of their prevention officers. Yes, Substance Abuse Prevention Officer, Michaela Bourne and Paulette Atkinson. Welcome to the program and Happy New Year to you both.
Well, thank you very much. Good morning. Good morning to Barbados, and Happy New Year to all of you as well.
And to you, and Happy New Year, Barbados. Good
Yes.
morning.
Now, we're doing something here that I haven't heard about in forever, and that is badge time for Scouts and Brownies. Now, you all have something called the Substance Abuse Badge, and today is going to be the Substance Abuse Badge Day for Scouts and Brownies and a community drive-through. Break it down for us, Bolivet.
Well, I'm going to defer to Makeda to discuss the badge,
All
and then
right.
I'll talk about the drive-through.
No problem.
Thank you, Paulette. Yes, the National Council on Substance Abuse, we started to work with the Boy Scout Association more than 10 years ago. And out of that relationship, we have developed the Substance Abuse Badge, which we have been working with the Scouts and other uniform groups. So last week, Thursday and Friday, all day, we had just over 500 Brownies and Boy Scouts, and we were able to complete the first phase with them towards their substance abuse badge.
Okay.
It was done online, and we used technology to be able to teach so many students within a short space of time.
500 is a lot.
Yes, it was. It was exhausting, but it worth every moment.
Okay. What were some of the things that they need to do to be able to attain this badge?
Excellent question, Wendy. What we have looked at, the badge that was designed in-house by one of our officers, Mrs. Greenidge, it was based on further developed based on our primary school research. So out of our primary school research 2020, we recognized that just over half our respondents stated that they at some point of time used a drug in their lifetime. The number one, just over 50%, was alcohol. Then energy drinks. A lot of persons don't know that caffeine is a drug, and it is in energy drinks, and they give the children. And then big on the list was inhalants, using household products at some point of time. Not inhalers, but inhalants. So,
Because I was just going to tell you, there's so many asthmatic children. Like, we got to make sure they have it right.
Household products. And then we have very small percentage, like 4%, who reported using some form of tobacco or marijuana, Fanta, at some point in time. So out of that research, we believe one child being exposed to any type of substance is one too many.
Yeah,
so
agreed.
we have used that information to further develop the badge, and you have to complete modules on all of the drugs I just mentioned.
Okay.
So we looked at what the drugs are. We also look at the effects on the body as the individual chooses to use it, the effects on the family, your school, and the community. So when you come, we use different methodologies, including a lot of games.
I'm sure they love that
Oh
part.
yes, a lot of games. We use interactive videos. We use things like matching cards to get the information over. So it is very highly activity based.
Because based on what I'm listening to now, it means, because I believe you can join Brownies from like about 7 or so.
Yes.
So that means that you structured it in such a way that those from 7 to 11 can be a part of attaining this badge. You don't have to wait till you reach 10 or whatever to sit for it.
Yes, your phase one is actually the beavers. We have done work with beavers who also have their badge, which is younger than 7.
Okay.
And then we do work with those 7 to 11, which is this badge that we are referring to, that we did some work last week. And we are continuing to work with them to the end of the year, because phase 2 is that they have to complete modules on their own through Nearpod. And then we also have the substance abuse badge phase, which is the older one. So we just did the Scouts before, which was we have members from the land, the sea, and Air Scouts who we did
I
some
didn't even
session
know
with
we
them.
have Air Scouts now.
Yes, so we have
Awesome.
those. So we are working with them as well. And we have moved the badge to a place that actually any uniform group, so it could even be a youth group, a church
Okay.
youth group, can call us and they can apply to do this badge as well.
That's nice.
Yes,
That
it
is
is.
awesome. Now, Paulavette, it's a month of celebrations that NCSA is looking at in terms of making Barbadians aware of what needs to be done and how it can be done in terms of preventing substance use and abuse. You're having a community drive-through.
That's right.
What communities are you touching? What are you looking to impart once you go into those communities?
Thank you, Wendy. And let me say that we are strengthening prevention this month and throughout the year. We have done many years of awareness building. We're continuing on that, but we ensure that we work closely with our stakeholders, our families, our communities, because our research continues to show that people get introduced, or youth get introduced to legal substances in the home. And in the community, it is much more pervasive, much more available. So basically what we are going to be doing, we started to go back out to our communities post-COVID, and this is just another initiative to really strengthen our relationships with families and communities. So this Friday, from 10, we're hitting the road. And we're going to be driving through communities near our office. We're starting from our Belleville and Pine Road location. We're going through the Pine, we're going through Wildy, we're heading up the highway, we're going through Sergeant's Village, onto Kendall Hill, Gall Hill, Silver Hill. Look for us, we're coming. Wharton, we're going via Thornbury Hill, Calendars, up to Parish Land.
How are we coming?
I mean, we
by
are
bus,
coming by bus.
car?
We
Okay,
are coming by
okay.
bus, old time bus. Look for us. The NCSA is going to be on the road.
Okay.
And we're going to be joined by some of our other members from the Ministry of Home Affairs. They're very supportive. And we're going to be on the road. We're coming out to communities near you. You have an opportunity now to engage with us directly. Hear about our services, our counseling service, which is available free of cost. to
Which
any
many might
Barbadians.
not know.
People don't know. How do you get help if you or a loved one or someone you know is experiencing an issue with substance abuse? Not only can you call us at 535-NCSA, but you can also engage with our counselors. Find out exactly what does it mean when you have addiction. What is that? How can I get help for a family member? What do I do? Because invariably, many times, people are in a pickle. And it's like, who do I call? What do I do? Who do I speak to in a way that is confidential, that my business doesn't get out there? So we're coming out to the communities directly. We're letting you know about the wonderful programs like what Makeda mentioned that are going on every day in schools. School starts back today.
Yes, it
We're
does.
saying hello to all the teachers across the land, primary schools, secondary schools, even in our tertiary educational institutions. We just resumed working with UE and the BCC, SJPI, and it's important that we understand that some education is formal, some is informal. So we work with sporting groups, with the church, and letting people know that this is an integrated approach. It's everybody's business. It's not just persons who are impacted. Prevention is everybody's business. So we want to strengthen that relationship.
Because we make the assumption that just because it doesn't touch our doorstep directly, that has absolutely nothing to do with us. But we're looking at something which potentially can be a scourge to our society as a whole. And we need to be able to be our brother's keeper in these times.
Exactly. Strengthening prevention means working together and seeing yourself as a stakeholder in terms of preventing the issue and also being aware of how you can intervene to help those who need support. And recognizing that, like you said, it may not touch my doorstep, but if it's an issue in the community, it has an impact. It has a ripple effect. So we want to ensure that persons are not only aware, but they know what to do. What are the actions that can be taken to stop it, to arrest it? We work continuously as well with our treatment and rehabilitation providers. So our counselors are going to be on the bus.
Okay.
We also have, personnel who work within the community, the heart of the community, with vulnerable groups that you don't get to see. And they too need to understand how they can get help, how they can act and work together to prevent the issue of substance use. So we'll be coming out We'll be going all the way up to Sayers Court.
But you know what? People
Oysters,
ask once
etc.
you're coming with information, they're also expecting fun prizes, surprises,
yes.
giveaways.
So you have to look out for us because we will have some giveaways, and it's going to be fun. So you may be asked to answer a question. We're going to have our bullhorn. We're going to be out there. We're going to be spreading the message, but it's going to be a fun and engaging time. We're going to make some stops as well along the way. So look out for us. Places like Oystons and so, that's a busy area. You know, and it's all about engagement.
And it's on a Friday.
It's this Friday.
We like excitement on a Friday.
Exactly.
We like excitement on a Friday.
So we're really excited to really go back out and to be engaged with our community stakeholders.
Yeah, because I guess too, the pandemic would have dealt more or less like a double whammy for those who may already be substance abusers, in that they would have been feeling already locked away and isolated from before maybe, and then now COVID disconnecting and not being able to go to where they wanted to at a particular time, what have you, to get that help maybe that they were looking for.
Yes.
It's great to know that they can reach out and touch once again to get it, you know.
And that's important. Mental health is part of our total health. Our spiritual, mental, physical health is a totality. It's a holistic approach that we take at the NCSA. And is letting people know that you are not alone, that this is a supportive community. We're here for you. And no matter what it is, if you feel a sense of despair, you can always call us. And this is a way of reassuring and strengthening that, that linkage with families, with communities, with our counterparts, and recognizing that we can't do it alone.
We can't, and we shouldn't try either. Not when there are agencies like NCSA providing that outlet that we need. Now, I'm surprised that you want more people to join with this badge, because 500 is a lot, and then you're managing them online as well. In terms though of the individuals looking to go through all those assessments and all those quizzes, how big a team do you have?
Very good question. There are only 4 substance abuse officers, and there are only 2 counselors at NCSA. But we are employed to get the information out there to Barbados.
Okay.
And as you can imagine, we cannot do it on our own. So since COVID, we have increased our use of technology. So even during COVID, NCSA never shut down.
Okay.
We were always accessible to the public through technology, through education, through technology, various platforms we use to make it interactive as well.
But is that something that is advisable, Paulavet? We make the assumption that as a drug abuser, user, that you would want that closeness in terms of sharing, well, yes, I've been getting hallucinations after I either smoke or drink or do whatever. You're not sure that you might necessarily want to go on a Zoom call and discuss it with the counselor.
Well, the thing is that, you know, there are different facets, and everybody experiences drug use or abuse differently.
Yes.
So we have to be multifaceted and offer various outlets where people can reach out. It doesn't mean that if you start out by having a counseling session online, that you will continue to have every session online. But we want to get you involved in the first instance, get you connected, so you recognize, look, I need to talk. I need to speak to a professional, someone who can listen and who can work with me to get back on track, to get the necessary support. So if it means that the first point of reach is the telephone, we use it. If it means that the first point of contact is via a Zoom activity, that's the first point of contact. And then from there, we engage further. And it's all about strengthening that linkage.
Yes.
That linkage now.
And we need
and that connection.
We need that. Now, in terms of the numbers she was talking about in terms of support at the NCSA of itself, how much volunteerism do you all encourage in terms of like tapping into the wider social work pool, the wider psychology pool, that type of thing?
Yes, we encourage volunteerism at NCSA. We need our volunteers. Actually, we are in the process of relooking how we use volunteers so that we can use volunteers more and use them by their strength. Currently, we do encourage internship at our organization. We have social workers at different levels, psychologists. So once we have the program and it's suited to what they have to do for their internship, we do accept interns, and they have been a great asset at our organization as well. So what we're giving to them, they have been great in also giving to NCSA and the wider public through the programs they will do at NCSA. So that is a very important aspect of NCSA.
And I'm sure that the institutions are happy to hear that this morning too, that more of them can channel their people through you to ensure that they can get what it is they need to get done, because they're completing their process and you all are getting someone to help you all along the way to reach that many more souls who actually need the assistance. Now, Paulette, in terms of the strengthening and the community drive-through, we have an entire month. We're driving through on Friday. What after Friday?
After Friday, we're going to have some online webinars and workshops. We're going to have some face-to-face engagement with our stakeholders in law enforcement. You'll hear more about that in the coming weeks. We're also going to be propelling our research later in the month. You'll hear more about, what our research
we like the numbers.
Oh, yes.
We like the
and we are
numbers.
driven by research. It's important to ensure that we have that evidence base. We'll also be facilitating some workplace pop-ups and so. So we have a plethora of, a wealth of activities which are integrated across various sectors, and again, engaging our stakeholders, working within our schools. Those continue our ongoing school and community programs, and you'll hear more about our counseling drive.
Okay, wonderful. So I want to wish you and Makeda all the best as you go through this month of activities. We know it goes far beyond the month, but I wish you the best, because it'll be more intense now as you try to strengthen across the board. I want to thank Makeda Bourne and Paulette Atkinson, both substance abuse prevention officers with the NCSA.
Morning, morning, morning.